Good evening. I am Dr. Sudha Rathna Prabhu. I am a pediatric metabolic medicine specialist. So, what is our specialty and what is it going to help and how is it going to help mothers as well as babies? Now, as you know, there has been immense advancement in the field of medicine with so many tests, and we have come to the extent of deciding how to get which baby, how with disease or without disease. So, we have developed so much, but are we at the right place? Are we with the right doctor? Is very, very important. So, there are certain indications. Who and all are supposed to come to us and what treatment do we offer? See, counseling. Counseling is an important part of every doctor's duty when he or she sees a patient. Counseling does not mean it is only for people who are having the problem. We do counseling called genetic counseling or even an ordinary counseling to educate what is happening to the parents and what will happen if we don't do certain precautions. So, now let us come to what is happening to today's trend of pregnancy and childbirth. See, as we see in the past, the wedding of women took place around say 20 to 21, but now women want to be self-dependent. So, they want to study, they want to work and they get married late. So, the late marriage is one of the most important problems which affects the childbirth. How? See, any elderly couple will have a tendency to get certain genetic disorders. So, how do you handle this? In case you have an already known disorder in the family, we can help you out much easily. But if we don't know and you are scared and you happen to get married late, today so many techniques have come and we offer counseling as to what is the possibility of you getting it or will you get it or you will not get it. So, you have to only come and tell us what is what to understand without any hindrances to what is happening in your family and tell us correctly the sequence of events when we can help you out to know whether the disease is present or not. For example, if there is a couple who are having 2 or 3 abortions, say for example, and they got married early, but they are having recurrent abortions. So, what is my role? What is the role of a metabolic genetic specialist? So, we have to first find out, see, when there is more than 3 abortions, it is definitely very, very dangerous. So, something has to be done to find out whether something is wrong with the mother or the father. So, genetic counseling is an important component of treatment for these metabolic disorders. In abortions, we also go into the depth of when it took place, at what stage it took place, and what were the circumstances. And genetic tests are easily available based on what is the requirement of the couple. At Mehta's, we do have a good panel of tests which we choose according to the patient's need and we do a screening. Today, it has advanced so much that tests like how ultrasound is being done during pregnancy, which detects a large number of disorders, has gone into the next step where we can do genetic analysis of the baby inside the uterus and find out if the disease has specifically affected the baby or not affected the baby and decide about the continuation of pregnancy. So, metabolic disorders are also being increasingly detected only because we have got much more tests. So, you want to know more about if in case your brother or a sister has a problem, whether you will get it or not, please approach us. We will give you much more details on how to go about metabolic genetic screening.